Well, my name is David Gill and I'm the Learning Disability Advisor for Children and Young People's team, NHS England.
Okay, my name's Eric Barker and I'm the Workstream Lead. I work for NHS England and we're part of Building the Right Support, which is part of transforming care for people with learning disabilities.
And my name is Sue North and I'm the Social Care and Education Advisor in the Children and Young People's team in the Transforming Care programme.
We work in a specific team, which is quite a small team. We have 11 people and we're employed really in different parts of England, and what we're trying to do is to embed a clear strategy so that children and young people are part of the wider work stream, and really that's about improving lives for children and young people.
So how does CTR work for children and young people?
So CTRs, or current treatment reviews, the same principles apply to children that apply to adults with current treatment reviews. But in addition to that, we feel that other things need to be considered. And one of the big things that we've tried to do is to make sure that when a current treatment review happens for a young person, that all of the child or young person's needs are considered. And for us, an important part of that plan is their educational needs, as well as their care needs and their health needs. We don't directly work a lot with children, we work through other people because our focus is about developing a strategy really and making sure that that strategy is applied across the country.
So finally, is there anything you would like to add?
I sort of feel like I want to add that children are children first really, and that we talk a lot about the needs of children, but what we need to remember as well is that each child has got lots of strengths and that they're unique really. They've got their own interests, they've got their own hobbies, they've got their own personality, and for all that they may have needs in some areas where they need support, we've got to remember that underneath this is a child who's unique and who has lots to offer really, as well as may need support. All children, as I said earlier, need support, but we need to recognise the positive things about each child and work with those positive things really to make sure that, you know, we see children as children first really, as people first.
The reason I'm interested in this work is because I've lived certain things, I've gone through certain services and I've seen good and bad in these services, so I want to offer my experience of going through these services in the past, what worked for me, what didn't work for me, to help improve the services for children and young people in the future. Because one of the things I've recognised is that children, you know, when they go towards, you know, adult age, they seem to get forgotten about. So it's about making sure there's a natural progression in services for children to adult services as well.
Like a transition?
A transition period that people do get forgetting, and if the service is right from a children's, you know, when you're a child, it's about making sure that stage, getting it right at the start and making sure that goes into adulthood, because children do become adults eventually.